Thank you for participating in our other lecture. Today, we are going to be talking about Sanghan 学派. Basically, it's a cold injury doctrine. And this is one of a class in the course of overviews of TCM classics and doctrines. Sanghan 学派 is a pretty influential school of thought. It's probably one of the most comprehensive, one of the most studied doctrine in all the TCM school of thoughts. And we should really start looking at the author. And Dr. Zhang Zongjing is considered to be the father of TCM. Zhang Zongjing, and sometimes we call him Zhang Ji, was born about 150 AD, passed away at 219 AD. He was born and raised in Henan province. And he's, at that time, very reputable physician. Has the same reputation as physicians such as Hua Tuo at that time. He have incorporated his clinical experience, collected many years of other people's of experience together, and established several very interesting and innovative fundamental works for TCM. 1. 6-channel differentiation for the injury by cold pathogens, what we call the 六经辩证. Second, he actually looked closely into Zhanghu differentiation for miscellaneous conditions. You must understand during that time, which is a good solid 2,000 years ago, they don't really have a robust understanding of Zhanghu differentiation yet. So Jing Gui Yao Lue, his other book, actually explains a little bit and delve into a little bit of the Zhanghu pathology and understandings. So Sanghan Zabing Run, his book, it's an authoritative publication. It's a must-read for all practitioners of TCM. It was lost during the wartime, and it was, thank heaven, republished and rediscovered and revised during the Song dynasty. In his book, there's 2 portions, the Sanghan portion, the cold injury portion, and then the Jingui portion, which is Jingui Yao Lue, or sometimes we call it miscellaneous disease portion. Now, if we look at Sanghan Run portion, which is where we're really focusing on today, this book has 10 sections, 22 chapters, and it gives us very good 113 fundamental formulas. Section 1, it dwelt directly into diagnosis, mainly post-diagnosis of Sanghan. What are the poses of people who's injured by cold pathogens? Section 2, it goes into etiology, progression of a disease, analysis of wind and summer heat diseases. So already at that point, Dr. Zhang Zongjing already recognized that Sanghan is not the only pathology of all diseases, but there are other pathologies that's caused by wind pathogen and summer heat, for example. Section 3 to 6, this is the main bulk part of his writing. And this really focuses on the explanation, elaboration, and introduction to his idea of disease progression we call the 6-channel differentiation and its diagnosis and treatments. Section 7 to 10, it's on the area of treating cholera, special topics on treating cholera, and how to help people to recover, the recovery care portion. So if you look at the content, it's really based on the Su Wen chapter 31, discussion of febrile diseases. And it classifies febrile diseases into 6 stages: the Taiyang stage, the Yangming stage, and the Shaoyang stage, which tells us the three yang stage conditions. And it further progresses to the Tai-yin stage, the Shao-yin stage, and the Jue-yin stage. This is the three yin diseases. So these are the yin portion of diseases. So to really understand Shanghan well, I think it's very important for us to really delve really into what is the basis for injury by cold. Well, Dr. Zhang Zongjin told us that it really came from Neijing Su Wen, chapter 31. In this chapter, it discusses, and it basically, the title of this chapter is the discussion of febrile diseases, basically disease that has fever. And Huangdi, if we look at some of the passage, I'm going to go through the passage with you here. Huangdi inquired, what we know of febrile disease today belong to Sanhan category. Some people died and some recover from it. The ones that die usually occur within 6 to 7 days from the onset of a disease. The ones that lived usually takes more than 10 days to recover. Why is this? And this is Wang Di asking Qi Bo, his court physician. Qi Bo replied, well, the giant yang, at that time they used the term giant yang, basically is what we call Ju Yang, is no different than Tai Yang. This basically means Tai Yang. Tai Yang connects with all 6 yang channels. Its channel branches to Du 16 Feng Fu point in the back of the head. Therefore, it is the representing channel of the qi of Biao. So it's a Wei qi. This channel really is the channel that really fights off pathogens, fights off. It's like the front line. It's the first front line in dealing with any kind of infections and outside exogenous attacks. So Qi Bo continues to say, when a person is attacked by a cold pathogen, the person will exhibit febrile diseases. Most of the time, even though the fever can be severe, but the person will eventually recover and will not die, most of the time. But if both yang and yin channels are simultaneously attacked by the cold pathogen, and if our channel and if our body is weak, then death frequently is inevitable because our body cannot handle the attack, especially when you attack both portions of our body. And this is how Qi Bo elaborated to Huang Di. Continue onward, Huang Di inquired further, well, I would really like to know more about the disease progression. Qi Bo replied, well, if we break it up into days, on the first day of Sanghan, our Ju Yang or Tai Yang is attacked. The first exhibition is a certain type of stiffness or headache. So you're having headache, you got neck pain, you got back pain, and some stiffness. That's kind of like the first day symptom. And on the second day, Yang Min is attacked. Well, Yang Min masters over our flesh, our meat, our muscles, our tissues, and its channel runs parallel to the nose and branches into the eye. Therefore, it exhibits, second day, fever, eye pain, and dry nose, and difficulty lying down because of fever and the restlessness. On the third day, Shao-yang channel is attacked. Shao-yang masters over gallbladder, as we know. Its channel traverses through the hypochondria, the rib area, and branches to the ear. So therefore, during this period of time when Shao-yang is diseased, it will exhibit the symptoms of rib pain and hearing loss. At this point, all the 3 yang channels have been attacked. but has yet to enter the organ, the Zhang organ. Proper diaphoretic treatment, basic sweating method, can dispel the disease. So it's saying here is that it doesn't matter which yang channel, diaphoretic method is suitable for all three yang channels. This is what Wan Di Neijing telling us. On the fourth day, Tai Yin is attacked. Tai Yin channel, as we know, traverses through the spleen stomach region and branches to the throat. Therefore, symptoms of the abdominal fullness, distension, and dry throat. On the fifth day, Shao Yin is attacked. Shao Yin, as you know, is the channel that traverses through kidneys and branches into the lung and also ended at the root of the tongue. Therefore, symptoms of dry mouth, dry tongue, and thirst is prevalent in Shao Yin diseases. And on the sixth day, Jue Yin is attacked. Jue Yin traverses through the genitals and branches to the liver. Therefore, restlessness and scrotum shrinkage is noted. At this point, all three yin and yang channels has been attacked. All the 5 zhang and 6 fu organs subsequently are all diseased. Our nutritive yin, our defensive wei, both stopped flowing and being functional. Therefore, 5 zhang are stagnant. When the 5 zhang, the zhang fu is not stagnant, especially the 5 zhang, death is inevitable. But if cold pathogen, and this Qi continues, did not attack both yin and yang channel, on the 7th day, Taiyang disease will decrease and the headaches gets better. On the 8th day, Yangming disease decreases and the fever gets better. So it's basically saying on the 8th day, the fever dies down. On the 9th day, Xiaoyang disease decreases and the hearing returns. On the 10th day, Taiyin disease decreases and the abdominal fullness is down and the appetite is back. On the 11th day, Shaoyin disease decreases, the thirst and the dry throat abates. The person is able to sneeze. And on the 12th day, Jue-yin disease decreases, testicles relaxes, the testicular shrinkage disappears, pelvic is soothed, pathogenic influences are gone. Therefore, the person will recover. Now, if we look at this kind of 7 disease to die, and approximately looking at 13, about 11 to 12 days of recovery, this sounds like a flu. And this most likely is influenza, commonly known as the flu. As you can see, some of the disease symptoms are not very strong and some are weaker. Now, when we go to, this is in Neijing now, when we go to Shanghan, Zhang Zongjing was able to break it down even more in detail for us on this disease progression. Now, if we look at Shanghan Lun's differentiation and treatment principles, we will realize Zhang Zongjing really incorporated the Zhanghu differentiation. He elaborated upon the channel, not just the channel, and also Zhanghu disease progression simultaneously. And he was able to establish 8 main methods of treatment. Start with diaphoresis, sweating method, emesis, vomiting method, purgation, pooping and peeing method, cleansing, cleaning the heat, harmonizing the qi, warming the cold away, tonification, tonifying the deficiencies, dissolution is the last one, is dissolving any kind of tumor, nodules, and blockages. This becomes the 8 fundamental treatment principles or treatment methods in Chinese medicine, mainly applies to herbal medicine. So looking further into the publication history, Sanghan Zabing Rum is just a fantastic book. It was known to be published around the Three Kingdom era and is lost during the wartime. And it was able to be republished, and we discover in a section of Dr. Sun Simiao's Qianjing Fang, which is the 1,000 Golden Formulas, and Dr. Wang Suhe's Mai Jing, which is the classics of Pose. So these two books, we are able to get a glimpse of Sanghan Zabing Rum, and this is how this wonderful and important book is passed down. So if we look at later on, there are so many people who revere Sanghan Rum as the true Bible TCM. Because Huangdi Neijing, even though has a lot of theories, but really the applicable part, where we are really starting to see syndrome, where we start to see treatment principle, where we start to see disease progression, where we start to see all the 100 so formulas that can be used and still used widely today. We find this in Sanghan Rum, in Sanghan Zabing Rum. Therefore, this book became the #1 most revered and most well-studied classics in all TCM fundamentals. So there are a lot of elaborators. There's a lot of translators. There's a lot of elucidators. And there's a lot of elaborators. People later, doctors, trying to learn and try to understand what Zhang Zongjing is trying to teach them, and elaborate upon his work and make it better, or make it so they share their understanding and their lifetime of clinical work that based on this theory. So there's a lot of types of related publication and a lot of TCM physicians that focuses on Sanghan Rum. And the last count, publication and physician is like 600 plus of known publication and physicians. And there's two major types of looking at Sanghan Rum, two major kind of scholarly work. One is a translation elucidation. It's a direct translation of the work. And second is specific topic discussions. For example, how does Sanghan deal with colitis? How does someone dealing with women's disease or not deal with women's disease? How does Sanghan deal with parasite situation? These are special topics discussion, and later on a lot of doctors trying to look at special topic and trying to see if they can use the school of thought of Sanghan Rum to be able to treat them. Okay, so we see quite a bit. Now, last time I went through Jingui Yao Lue, but quickly, Jingui Yao Lue is another book within this Sanghan Zabing Rum. Sometimes we just call it Jingui. Okay, sometimes we have the long name, Jingui Yao Lue Fang Rum. 3 sections, 25 chapters based on disease type, has 262 formulas to offer, include diseases, internal medicine, gynecology, external medicine, emergency care, and dietary guidances. It's also based on Neijing, Su Wen, but is not based on the Shanhan, the febrile disease discussion, but rather is based on the Zhanghu theories of the Neijing. Now, again, Jingui was also lost, just like Sanghan Rum did. And again, it has two types of publication. One is a translational work, elucidation work. The second is special topic discussions. And there's 100 plus TCM physician and publications that devotes their energy and their life force to really trying to help other people understand what Jingui Yao Lue is. So what is the definition of Sanghan? I think, to really understand this whole book, I think the very first thing we need to understand what Sanghan means. The book cover definition of Sanghan is that today's, like in chapter 31, it says today's febrile disease all belong to the classification of Sanghan. So in Neijing, it was very explicit. But here's what the Neijing says, today. Okay. It did not say yesterday. It did not say into the future. But what it say at that current time. All febrile diseases at that time are known to all belong to the classification of Sanghan. So, actually, later on, as we discover that a lot of infectious diseases are not just, a lot of febrile diseases are not just from Sanghan. It can be from parasites, it can be from heat, wind heat can be from dian heat, it can be from wind pathogens. So therefore, it's still correct that Neijing says at this time, today's febrile disease all belong to the classification Shanghai. All diseases are due to the wind cold invasion during that time. So therefore, Sanghan, it's about discussion of wind cold invasion to start with, and miscellaneous disease, and the disease progression that comes after that, and how it transforms into different diseases. Now, having said that, the truth is, this book, Sanghan, is not really all about cold injury. It is about how our body reacts to the pathogen, how our body becomes diseased, bit by bit, by bit, by bit, how our body withers, weakens, and eventually demised, or how our body be able to work through different phases of disease, recover quickly or recover slowly, and really gets rid of a lot of these different symptoms. So it's a brilliant book in a sense that it's the very first book that really gives us the whole concept of disease progression. Now, is Sanghan 6-channel differentiation only apply to febrile diseases? I don't think so. If you look at a lot of the masters of Sanghan Run, such as in Beijing, Liu Duzhou, he is a very famous physician and studies Sanghan Run for his whole life. And if you look at his formulations, he have used widely, as we know, all the Sanghan formulas for all the internal medicine conditions. And a lot of them are non-infectious, and a lot of them are not even febrile. And the reason is not because that he is trying to break away for no good reasoning. He break away because he knows is that disease progression for the Sanghan, the 6-channel differentiation, can be applied to many different diseases, chronic diseases, rheumatoid arthritis situations, chronic condition that lasts for a long time. You can still see that 6-channel differentiation in some of these conditions. That's why when we learn Sanghan, we are not really learning about the cold pathogen, really. We are really learning about the progression of diseases. We are learning about how our body fights disease and how we can help the body fight disease by using proper formulas in certain stages, not too early and not too late, and that's how we can help the body. So Sanghan Run and her focus is that singular Sanghan condition occurs less compared to combined with miscellaneous diseases. Therefore, discussion of both Sanghan and miscellaneous diseases together is logical. So what do we mean by miscellaneous diseases? Well, you can envision for a moment going back in time. I mean, Zhang Zongjing is in 100, 200 AD time, 2,000 years ago. Okay, so at that time, the life expectancy wasn't that high. The best, 30, 40 years old. What are people dying of? Well, they are not really dying of chronic old age disease. Most women don't even make it through menopause. A lot of times they're dying of infections. They're dying of influenza, simple flu. Well, I shouldn't say flu. The reality is, if you look at today, a lot of immune-compromised patients, senior citizens, and young kids are very much negatively impacted, and even death from flu epidemics, even today. So this is not a condition to just sneeze about. It's something we have to really pay attention to and try to stop this infection and this dreaded disease in its track. So, and therefore, a lot of times we have to combined with the discussion of miscellaneous diseases, because infectious disease can also bring on miscellaneous diseases. And also our own body's weakness and imbalance also allows dysfunction of certain zanghu functions, and that creates miscellaneous disease as well. So we are focusing on constitution, we are focusing on disease progression, focusing on etiology, pathology. We're looking at the differences between person to person. Therefore, the discussion only in Sanghan, cold injury by cold, is absolutely not comprehensive enough for this book. So again, the focus is constitution, disease progression, etiology, pathology, and not just injury by cold. Therefore, six-channel differentiation really incorporates the understanding of both Sanghan and Zabing. Okay, Sanghan and Zabing. So six-channel differentiation is really no longer for exogenous disease anymore. It's also used for endogenous disease. And if you can understand and see that, then you say, oh my God, you can apply this school of thought into everything we treat. That's why this book, that's why this publication, that's why this concept framework, it is so popular even today with a good TCM physician. Sanghan Run elaborates upon the condition due to pathogenic wind cold through the characteristics of six-channel. So the essence, again, repeat again, of Sanghan is a six-channel differentiation. And six-channel differentiation is based really on the physiological and pathological expressions of both the Zanghu and the Jingluo, both the organs and the meridians. Therefore, the essence of Sanghan Run is six-channel differentiation and not wind cold invasion, as I have to repeat that again. So the true definition is that Sanghan Run is the study of six-channel differentiation, SCD, and how SCD is applied to all diseases, including infectious, exogenous disease, and miscellaneous endogenous diseases, regardless of the nature of the pathogen. So Su Wen says physicians who diagnose well will first inspect color and palpate pulse to differentiate yin and yang. That's the reason why all diagnostic methods in TCM originates from differentiation of yin and yang. And this is where big part of the six-channel differentiation also included the 8 principles of differentiation. Okay, so he's looking at paired polarity imbalances, and there's 4 of them. One is the nature of imbalance. Yin and yang. Is this an yin type of imbalance in a sense? Is this yin form of disease? Is it a cold type of disease? Or this is a yang type of disease, like a heat type of disease? Is this weak? Is this strong? The nature of the imbalance. The second polarity is the nature of pathogen. What's a characteristic of a pathogen? Is it cold? Is it hot or heat? So you have yin yang, you have cold and heat. Now, so you have the invasion, so there must be a nature of anti-invasion factor. We call it anti-pathogenic factors. This would be your body. Is your body in good balance? Is your body in excess or deficient? Okay? Excess or deficient. And now the whole body is excess or deficient. Maybe there's some organ that's excess and some organ is deficient. So that's the nature of your body, the anti-pathogenic factor. Then the 4th pillar is the location of disease. Where is the disease? Is it in the exterior more, or is it deep inside the interior? Okay, so you have therefore yin yang, biao li, han re, xu shi as your 4-pillar, 8 principles of differentiation. 8 principles of differentiation. All right. So if you look at differentiation process, Sanghan really takes us from 2 dimensions to 3 dimensions. The 2 dimensions are simple, like yin-yang differentiation. The 8 principles differentiation is 2-dimensional. Is either you're in condition or yang condition, heat condition, cold condition, excess or deficiency, right? Okay? So those are what we call bipolar, polarity. That's a very 2-dimensional way of looking at it. Now, 6-channel differentiation, the 6-channel differentiation is changing from that 2-dimensional paradigm to a 3-dimensional paradigm in how we look at things. So if differentiation is like pinpointing a location, like a GPS, we're trying to pinpoint a location. Now, yin and yang differentiation would be trying to find a neighborhood, okay? Where do you live? Which neighborhood do you live in? Oh, you live in Los Angeles. Well, Los Angeles is a big city. So you got to kind of refine and tune it down. Oh, you live in Koreatown. Okay, the 8 principal differentiation is like finding a street. Well, where do you live in Koreatown? Which street do you live in? Oh, I live on Vermont Avenue. Now, the 6-channel differentiation is like finding the house on the street. Okay, so you go from neighborhood to street to the actual house. Okay, so you're differentiating from very rudimentary, general differentiation to 2-dimensional differentiation to a 3-dimensional differentiation. And if you look at the 6-channel differentiation in the positional relationship, the Tai-Yang, the most yang, embraces all. It is the most yang qi of the body. Embraces everything inside of it. So Tai-Yang is really in positional location, is really our outer layer. Outer layer. It's our skin. It's our skin. It's the top layer of everything. Then if we go inward, then you're going to be hitting Yang Ming, Sao Yang, Tai Yin, Sao Yin, and the core is Jue Yin. The core is Jue Yin. So the normal channel progression, if the disease behaves, which we know disease never really behaves because each individual has different progressions. But in a normal progression, we're talking about the disease going from Tai-Yang channel to the Yang-Ming channel to the Sao-Yang channel, 3 Yangs. And once it's done with it, it goes to the Yin channel. It goes with first the Tai-Yin channel, and go to the Sao-Yin channel, and go to the Jue-Yin channel. This is what we call a normal progression. Okay? Now, Tai-Yang disease, or what we call Tai-Yang病, denotes pathogenic invasion of the foot urinary bladder channel. The Yang-Ming病denotes pathogenic invasion of the foot stomach channel. Sao-Yang病denotes the pathogenic invasion of the foot gallbladder channel. So on. Tai-Yin, the spleen. Sao-Yin, the kidney. Jue-Yin, the liver, for example. So there's a packing order. Now, why? There is, when we look at each channel, we didn't see any hands channel. We only talk about foot channel, but no hand channel. Well, it's on purpose. The packing order is that the foot channels are the main channel because they have direct connection to the associated organs, and the hand channel does not. Hand channel are the secondary channels due to their indirect connection to the associate zanghus. So in some way, you can say the foot channels are really there, more direct. And while the hand channel actually is more distal, more indirect. So that's the packing order. In each of the 6-channel disease, therefore, it has a primary effect and a secondary effect. The primary effect is usually the foot channel. The secondary effect is usually the hand channel. The Tai-Yang disease affects primarily the foot channel of the urinary bladder, and secondarily the hand channel of small intestines. while Yang-Ming disease affects the foot channel of the stomach, and the secondary would be the hand channel of large intestine. When we have a Shaoyang disease, it attacks mainly the foot channel of the gallbladder, and secondarily the hand channel of Sanjiao. On and onward. Okay, this gives you some idea of the sister relationship of the foot and the hand channels. So the main symptoms, when we look at earlier, when we look at Huang Di Neijing, Huang Di Neijing gave us a very good idea, shall we say a starter, like an appetizer. It told us day one is your stiffness and neck pains. It tells us the fever comes on the second day, right? If you remember that. And tell us the third day is a Shaoyang syndrome, which is you're having ear congestions and you're hearing loss and you're having rib pains. Tai-yin is the spleen channel, so on. So very minimal symptoms. Zhang Zongjing actually elaborated further. He's saying Tai-Yang Bin, the main symptom is going to be occipital headache or neck stiffness. And now he is zeroing in specifically where. Yang-Ming disease, you're going to have facial flushing, forehead pain, and dryness of nose besides the fever. Shaoyang disease, you're going to have hearing loss, chest hypochondriac distension, and bitter taste in the mouth. And Tai-Yin disease, you're going to have abdominal distension, which is exactly what basically Neijing says. And Shaoyin disease is sore throat. Okay. Jue-Yin disease is a vertex headache, and the sputant emesis of the mucus of the sputum. Okay. Now, then you talk about, Zhang Zongji talk about disease transmission. We talk about the normal transmission. Okay, we call that regular transmission. Then we also have exterior to interior transmission. We call it Biaoli transmission. Then we also talk about the overreaching progression. Overreaching is that you are so impatient, you just want to go to not the next stop. You want to basically skip the next train station, go to the train station afterwards. Okay, that's called overreach progression. So the regular progression we talked about before, Tai-Yang to Yang-Ming, Yang-Ming to Shaoyang, Shaoyang to Tai-Yin, Tai-Yin to Shaoyin, Shaoyin to Jue-Yin. That's your regular progression. The Biaoli is you could have Tai-Yang disease, and the pathogen did not just attack Tai-Yang, but goes in, instead of going to Yang-Ming, laterally it goes direct deeper into the Shaoyin disease. Okay, that's called a direct Biaoli transmission. Then you have the Shaoyang, for example, Shaoyang disease, your disease in Shaoyang, instead of the next thing, after Shaoyang, the next thing you should go into Tai-Yin. No, it goes straight to Jue-Yin, go directly to its related yin organs. So that is what we call exterior and interior transmission. Then you have the overreaching transmission. So this can be chaotic, can be confusing. For example, Tai-Yang instead of go to Yang-Ming, now Tai-Yang goes to Shaoyang. Okay? Tai-Yang goes to Jue-Yin directly all the way to the end. Or Tai-Yin goes to Jue-Yin. Okay? So this is called overreaching. Going beyond to the next post, usually go to the post afterward, or any post, any stages afterwards. This is called overreach. Now that's the disease progression. Then let's talk about disease type. There are also combination of diseases. There is what we call simultaneous combination. There are influenza where it hits you so quickly that it takes on both Tai-Yang and Yang-Ming channel altogether at one time. We call that a 合并, simultaneous combination. Or we can have ordered combination disease. You get Tai-Yang first, and the next immediately is Yang-Ming. And on the second day, now you have Tai-Yang and Yang-Ming all together now. But on the first day, you may just be Tai-Yang. So that's called an ordered combination disease. So let's talk about 合并, simultaneous combination disease, the four kinds. Okay, these four kinds are Tai-Yang and Yang-Ming together as one combination. Taiyang and Shaoyang is one combination together. Then you have Yangming and Shaoyang as a one combination. And you can have all the three yang diseases combined together. Simultaneous combination, 合并, tends to denote to yang channel diseases, not yin channel diseases. Now, orderly combination is a progression and combination at the same time. For example, you start with Taiyang disease, and you don't have Yangming to begin with. But then Taiyang progressed to Yangming, but it goes to Yangming, but the Taiyang disease has not finished yet. So now you have a combination of both Taiyang and Yangming. We call this ordered or orderly combination disease, or we call it Bin. Or you have Taiyang, for example, and transfers, and now the disease progression goes to Shaoyang, but your Taiyang disease is not gone yet. Okay, it's still there. So now we have both. Even though there's a progression, now we have ordered combination of Taiyang and Shaoyang. So there's really two kinds. The Taiyang combined with Yangming, and Taiyang combined with Shaoyang. Progressed and combined. Progressed and combined. So, treatment principle in general is the first order of things is trying to self-regulate yin and yang. Okay? How do we get the yin and yang? How do we get the 8 principles to regulate? How do we regulate yin and yang? How do we get rid of excess, nullify deficiency? How do we get rid of heat, get rid of cold? How do we now the least, working on the true qi of a body? So that's one. Second is to protect stomach qi. Save the jin, save the body fluid. Okay. When you have febrile diseases, the number one danger is dehydration. When you have dehydration, water, as you know, is probably the most important element for survival. You can live without food for a while, but you cannot live without water. Now, the whole body is exactly like that. Our cells can live without food for a while because it does have store of energy. But it cannot live without water for a while. So when you have febrile diseases, dehydration sets in. It can become dangerous. So therefore, the first order of matters to take care of is to make sure to protect the stomach qi. Because when you protect the stomach qi, your body can continue to produce and enhance its body fluid productions. Now, the second order of things is to further differentiate and look at 8 methods of treatment. Do we need to sweat? Do we need to vomit? Do we need to harmonize? Do we need to dissolve? Do we need to tonify? Do we need to warm? All these methods of treatment comes in play. So let's go through it. Sweating, han, diaphoresis, is relief of pathogens through sweating. Emesis is tu, relief of pathogens through vomiting. Purgation is xia, relief of pathogen through bowel movement and urination. Qin is cleansing, relief of heat pathogen through internal dissipation. He, harmonization, is to neutralize pathogens and also enhance the flow of qi throughout the body. Wen means to warm up the yang qi, is to treat situations where the yang qi is deficient. Bu, tonifying the body. Okay, xiao means to dissolve and shrink the pathogen. So this is the 8 methods of treatment. Now, the uniqueness of the Xianghan Run is that it established the 8 methods of treatment and is still used widely today. It's simple, and its formula does not have a lot of herbs, very tight, and the formula and syndromes are correspond together. You have this syndrome, you have this set of symptoms, use this formula. Okay, very tight integration and direct correspondences on what you have and what you're going to do about it. Okay, what you have as a disease and what kind of treatment you give. The herbs formula is right there. And flexibility, there's a lot of flexible modification. Zhang Zongjing spends a lot of time in looking at what you can do to add different herbs for different symptomatic changes, for example. Now, there are 12 categories of formulas, about 113 formulas. So you have the 桂枝汤 category, 麻黄汤, 小柴胡汤, 鸡子骨汤, and 泻心汤, 白虎汤, 承气汤, 理中汤, 真武汤, 四逆汤, 五苓汤, and miscellaneous and other formulas. If you can classify it, these are all some of the major formulas where the 113 formula gets classified into. Zhang Zongjing also brought us the first union of Li, Fa, Fang, Yao. He believed to really be a good doctor is not about just throwing any herbs and try something. It's about reasoning. What is the rationale of using a certain herb? And to have that reasoning, to have rationale, you really have to have a good grasp of the principles of disease, the understanding of etiology, pathology, the diagnostic methods, and not the least, the characteristic of the herbs. So the reasoning is very important. Once you know the reasoning of why people got sick, then you can come up with diagnosis and the methods of treatment. Okay? Look, you got Taiyang is being constrained. Well, it's diaphoresis method. Let's sweat it out. Okay? So that is a methodology, for example. And then with that, then you have a formula. A formula is a composition of different herbs. Now, obviously, we do know that formula can have just one herb. Okay, one herb can be a formula. But majority of time, that's not the case. Majority of time, formulas is a complex organization of several herbs that working together synergistically. Okay, so it can be 3-4 herbs to 25 herbs. Okay, there are some formulas as large as 50 herbs. So the formula will come into play. Then not the least is the herbs, individual herbs. How does the individual herbs work together in the formula with each other? How do they work synergistically or not work synergistically? What happens when they're combined together? Okay, so it's truly Sang Han Run really give us the first union, a first taste of this reasoning, methods of treatment, formula, and herbs. This Li, Fa, Fang, Yao, all four things kind of combine together to create a model of doctoring. A model of doctoring. So when we learn Sang Han Run, we need to learn the understanding of yin and yang, the Zhanghu and the channels, etiopathology in the 6 channels, its symptoms and signs, appropriate use and right dosage of the herbs and the formula, how is cooked, decoction methods, and how we need to carefully analyze each verse. So if we look at all the verses of Sang Han Run, like a Bible, it has 398 total verses. How fascinating that Taiyang stage, Taiyang disease, occupy 178 verses. It's probably the largest number. Why? Why does Zhang Zongjing spend so much time looking at Taiyang? Okay, well, let's continue. We'll come back to that. Yangming, 84 verses. Shaoyang, 10 verses. Taiyin, 8. Shaoyin, 45. Jueyin, 56. Cholera, 10. Miscellaneous recovery, 7 verses. So if you look at the major group is the Taiyang Bin, 178 verses. Because when somebody gets disease, first day, second day, if you can get rid of a Taiyang disease right there, you don't have to bother with anything else. There is an incentive to get someone well within that 1 or 2 days at the beginning of their influenza, of their disease, right off the back. Then you don't have to deal with all the rest of it. And frequently, we make mistakes. As doctors, we make mistakes. And a lot of times we make mistakes when the disease is in the first day or second day. Taiyang disease, we thought, oh, it's a Shaoyang disease. And we're starting to pacify the qi already and clear the liver. Or that, we look as a Yang-Ming disease already, and we're trying to purge too early. What happens when you purge, you weaken your body. So the Taiyang disease therefore become totally another disease progression. That's why Taiyang disease has so many verses. And the next is Yang-Ming. Well, you know what? 1 day, 2 day is still not too late when you get to third and fourth. Now you get to the next progression. Hey, if you can catch it in time, you don't have to have all these diseases that goes down to the next progression. So spend a lot of time, 84 verses. That is the second most verses. Once it goes beyond Yang-Ming, then it moves pretty rapidly through Shaoyang, Taiyin. So basically you got 10 verses for Yang-Ming, 8 verses for Taiyin. Because at this point, the disease are getting an upper hand. It start to move. Now, when you get to Shaoyin and Jueyin, well, you're getting to the end of the yin channels. If you don't recover, if you don't fight properly, death can become the next option. And that's not the option. So therefore, you start to see 45 verses in Shaoyin and 56 verses in Jueyin, because you're talking about saving people's life at this point. Okay? So you can see a lot of verses at the beginning in Taiyang Yang-Ming, a lot of verses at the end at basically Jueyin and Shaoyin diseases. Cholera, there's actually 10 verses. I think cholera, in this book, is probably one of the earliest documentation about cholera and how to treat it in Zhang Zhongjing. That's brilliant. I don't know, by probably about 500-600 years earlier than the Western counterpart. So Sanghan, in summary at the end, is a study of disease progression due to pathogenic wind co-invasion in a narrow definition. But Sanghan, in a broader definition, is the study of disease progression due to pathogenic invasion. Doesn't necessarily have to be wind co. And the key learning for us in the Sanghan doctrine and school of thought is the 6-channel differentiation. That is a brilliant masterpiece of studying disease progression that you can apply into internal medicine, into many different chronic diseases. It does not have to be just exogenous diseases. And other thing we want to learn is the disease transmission, the movement of a disease, and the management of the disease. Thank you so much for your time today, and I hope you have enjoyed this session, and I will see you next time.